And the last presentation for this afternoon is from Emma Adams. And so her presentation is co-producing understanding around access to mental health and substance use services for people experiencing homelessness.
Thanks, Mackenzie. Hi everyone, I'm Emma, and I'm sorry I'm the last presentation of the day. I'm imagining everyone is ready to leave, go get a cup of coffee, or run to the washroom because it's been quite a day, so I'll try and keep it short and brief. And if we can't get through all the questions, you can always find me when we've had some more caffeine and cookies. So I like to start my presentations out with a story, and I want to tell you about a man called Andy. In the beginning of 2020, Andy was living with his dad in council housing. When the initial pandemic started, he was scared, but he knew with his dad by his side, they'd get through it and everything would be okay. Unfortunately, things took a turn for the worse when in the summer, Andy's dad passed away. Before he knew it, he was being kicked out of the place he'd called home. Andy had become homeless. He hopped from couch to couch, but ended up in a hostel, and it wasn't like anything he could have expected. He found himself starting to drink just to cope with all that grief and anxiety and just sort of how he was feeling generally. Unfortunately, Andy's experience is all too common for people who face homelessness. And in Andy's case, he didn't know where to go to get help for his mental health or substance use. And the question I ask everyone is, would you know where to go in your time of need? So in collaboration with some amazing community-based organizations from housing and voluntary sector, we set out to really explore and understand how folks accessed community-based mental health and substance use services in Newcastle and Gateshead during the COVID-19 pandemic. And although I did speak to staff as well, today's presentation is really focusing on the experiences of those who faced homelessness. So how did we do this? Obviously, it was during COVID, so there was a lot of phone calls and a lot of phone calls from the comfort of my bedroom and having nice chats with people at all hours of the day. And so when we say homelessness, I use quite a broad definition, and I think hopefully most people in the room can recognize homelessness isn't just the people we see sleeping on the streets. It can be people that are hopping from couch to couch, folks that are in unstable Airbnbs, not knowing where they're going day after day, but also there's people who maybe are in situations of domestic violence and at risk of becoming homeless. So I spoke to 16 men and 10 women just about how they accessed, and in a lot of cases didn't access, support for mental health and substance use in their community. And then once we sort of got through those interviews, I thought, good God, how am I going to get through all this data and actually make sense of it? And if my accent isn't enough of a giveaway, I was not native to Newcastle, and there was a lot of words that I just thought, I don't know what those are, and I need some help. So I worked with 5 amazing individuals who had lived experience of homelessness, mental health, and or substance use, just to try and make sense of it all. And together we were able to come up with sort of 3 main themes. And so today, I'm not going to give them justice, but I'm going to do a quick whistle through all 3 of those themes. And what I'll say is there is a paper published on this, and it's open access. Anyone can see it afterwards. So the first area we looked at was this idea of inadvertent exclusion. And I think everyone in the room can say, when the pandemic rolled out, suddenly everything just stopped. Services suddenly just disappeared. A lot of things that you'd normally just go and ask someone in person, you suddenly couldn't do. And with service provision, that meant a lot of services switched to being remotely offered. And although this was great because it meant services could still exist, some of those reactive changes actually excluded the people we wanted to help the most. And so the first sort of sub-theme in that is my sort of homage to Dolly Parton, and is the idea that mental health isn't 9 to 5. And I think this is something that was not unique to COVID, but became all the more pressing during COVID, when a lot of the services that got offered out of hours were cut because folks had to reprioritize what they were doing. And I think someone really highlights this idea that it's often when we're at our worst and when we're at our moments when we need help the most that we can't get access to services. The sort of other 2 themes in this area, the first one focused around digital exclusion, and I'm going to try not to harbor too much on that. But I think what was really interesting around the digital exclusion element was the fact that in some cases, a lot of services did amazing things like offered people phones or gave people iPads so they could join calls. But I remember talking to someone and them saying to me, Emma, they gave me a phone and I didn't know how to make a phone call. And I thought, you know, I can get it. Like, my dad still has yet to figure out video messaging, like you think after 2 years he'd get it. But it was all too common for people not to actually know how to use those services. And so with digital exclusion, one of the things we realized is it's not enough to give someone access to a piece of technology. You also have to give them the knowledge for how to use that. The third sort of sub-area in exclusion was around this idea of just knowing what's out there. And I think that's a big thing. Like, I'm sure everyone can say when you're panicked and stressed out, you can never remember where anything is. And that's probably not the best time to find out where things are. And people talked about how this idea of, you know, when they were in that crisis, they just didn't know where to go. And most people just call 999, or if you're me, it's 911, because I can never remember 999. And they talked about this idea that often we need to think about creative ways of sharing information. And one gentleman actually told me he found out about a service just by passing the football stadium in Newcastle and there being a sign outside. And so there's these different ways we can learn to share information about services. The second sort of major theme was all around this idea of barriers to recovery. And we use that phrasing specifically because often people have quite negative experiences accessing care, and that then means that they don't want to go back. And I don't think that's something that's unique to people who experience homelessness. I think it's something everyone probably experiences at some point in their life. The first sort of sub-theme in there was looking specifically at the physical space in which services are offered. And I think this quote highlights that in a quick little nutshell, but it's the idea that, you know, we really need to be cautious of where we're providing services. And sometimes the environment of services can really hinder someone's experience. And maybe the environment that's best at the beginning of someone's recovery journey isn't appropriate at the end, and we need to be more aware of that. The second sub-theme looked at this idea of disjointed care and repetition of stories, which I think is probably something, if you know much about mental health and substance use, is a bit too common. And I think someone said it just became even more pertinent during COVID, where they just felt like staff were constantly off sick or were leaving services, and so they just had to keep telling everyone the same thing over and over again. One of the things people did say was, hopefully if people start working better together, that won't happen as much, and I live in hope that with the integrated care agenda, that might change. The sort of third sub-theme was about this idea of just not being ready for recovery, and I always feel guilty whenever I have to talk about this one, because it comes down this idea that if someone's in sort of a mental health crisis, they need help then. But often, if people are, let's say, using substances, they might be using substances to deal with something else. And so if you try and take those substances away, it's probably not the most recovery-oriented for them. And people spoke about this idea of working with them to figure out what they needed in that moment, and then they'd be happy to work with you about another element in their recovery. The final sub-theme looked at this idea around prioritization when resources are scarce. And this comes down to the idea that often we have to redeploy things. I think we're in this climate of austerity, and it's likely going to continue to be a challenge. And so we need to think long and hard about how we actually allocate resources. And this person spoke about the fact they called the crisis number 9 times before someone came out. And I would like to think if I called someone in a crisis, they'd come straight away and they wouldn't make me keep calling back time and time again. The final theme we found was around this idea of sort of the slightly more positive end, which was what can we be doing better to make services better for people and make people feel more comfortable accessing services. So the first area was around this idea of currently there felt like there was a bit of disconnect between what services are being offered and what the need is. And the solution folks suggested was working with people with lived experience and leveraging that expertise to make sure that in both the design and delivery of services, they're actually meeting the needs we need to meet the most. The second sub-theme was around this idea of choice and an active voice. We all had a lovely spread for lunch today, and if I took all those options away and only gave you the vegetable skewers, I'm pretty sure not many people would be too happy with me. And I think a similar mentality could be taken with how we offer services. They recognized you can't always give someone a choice in the type of service, but there's small things you could do. Maybe it's asking someone what time of day works best for you for an appointment. Would you prefer a morning or an afternoon? And just giving people that small choice and decision in their care made them feel so much more receptive to getting help. So that was a heck of a lot of information, and I'm feeling out of breath, so I imagine everyone's feeling a bit overloaded. And I just want to go quickly on the why does this actually matter and why does this care? And I've got 2 visuals up here on the board, which I developed with the 5 people who took me along this journey and tried to visually represent some of the things we found. And you can get them online, download them for free, print off as many as you'd like. And the things we sort of found weren't always unique to the experience of the pandemic, and a lot of the lessons we learned are relevant now and even prior to the pandemic. And it could be small, simple changes, like someone had made a suggestion around some of the language that's used in sheets for mental health and substance use don't actually make sense, and they don't know who they can call and when. And just working with people who have lived experience just to create those a little bit more accessibly would be important. I think the other thing that sort of came up quite obviously from people is just this element of how we could be working with people with lived experience in how we offer services and just getting input earlier on in the process rather than waiting until a service is already existing to get that input. And you can read a lot more about some of those recommendations there. So I'm going to leave it there, and hopefully we can gain some time back and go get cups of coffee. But if you'd like to reach out to me, you're more than welcome to. This study was funded through the School for Public Health Research, so technically not the ARC, but I'm currently employed through the Applied Research Collaboration Northeast North Cumbria in one of their mental health research fellowships through our Inequalities theme. Thank you for listening.